Welcome, everyone, to tonight's Legislative Learnabout. Tonight, we're going to be talking about expanding access to midwifery licensure and maternal health. And our guest today, our very special guest, we have Kristie Duarte. She's chair of the Hawaii Home Birth Task Force and president of the Hawaii Home Birth Collective. Thank you for joining us, Kristie, and inspiring this whole thing tonight. Laulani Teale is a mother, peace worker, peace cookie, birth worker, health worker, musician, artist, and activist from Kahalu'u, Oahu. She's been active in the Hanau community since the birth of her first child in '93 and has helped many others in revitalizing her Hanau traditions. She's had many great close teachers and mentors in her health and birth traditional knowledge and decolonization work, including Papa Henry Awai, Kamaka Hukilani van Olhofen, Medra Kanoik Napua, and Dr. Kikuni Blaisdell, in addition to her own tutu, who was born in Kahana Valley and told stories that helped rekindle family traditions. She's the coordinator of Ho'opai Pono Peace Project, which supports the council with logistics, documentation, and more. Thank you, Laulani, for joining us today. Carrie Ann Shirota is the policy director for the ACLU of Hawaii. Her past work as an enforcement attorney for the Hawaii Civil Commission and civil rights analyst for HUD's Fair Housing and Equal Opportunity reflects her deep commitment to safeguard and advance civil rights and liberties. So thank you very much, Carrie Ann, for joining us as well tonight. And I'm going to pass it on over to you.
Aloha kako, everyone. Thank you so much to Tanya and the Chamber of Sustainable Commerce for inviting us. As many of you have heard over the years, there have been some bills that have been introduced relating to midwifery, but we thought the timing was ripe to have this conversation because the current midwifery statute is set to sunset or expire on June 30th of this year. So we thought we have been asked to speak to a number of groups and share and highlight the current law, the law that we're supporting, and what we look to ask from community members in terms of support. So what we're going to do is just give you a quick roadmap for this evening's conversation. Kristie's going to give an overview of the current midwifery law, which was passed in 2019. I will share some highlights of the current litigation that is pending. We're also going to give some highlights of the proposed remedial legislation, which is known as HB1328. And Laulani is going to, in a way, take us back in time in terms of historical context, the practice of Native Hawaiian traditional and customary practices here in Hawaii, and bringing us up to the present. So with that, Kristie, if you could give us an overview of the current midwifery law.
Sure, yes, thank you, Carrie Ann. So the current midwifery law, HRS 457J, is also known as Act 32, 2019, and within it, the preamble, it does say that the legislature does intend to incorporate all birth practitioners over a 3-year period. So with that intent to make sure everyone was included and not criminalized, with that, there was a birth attendant exemption put within the legal language that was set for the end of June 2023. And with within that exemption, then there was a task force that was created within Act 32, 2019, and the task force brought forward recommendations every single year, hoping to make sure that these other birth practitioners would be able to be incorporated and not subject to criminal penalties or fines. And when the date got really close, and it passed after that, then there was some messaging or talk that maybe birth attendants are okay, they're not midwives, right? So they should be able to continue to practice. But an attorney general letter came out in early January 2024 that did clarify that birth attendants, along with many other groups, would be subject to criminalization and fines if they did not have a midwifery license. So that opinion kind of clarified the confusion. There was also another exemption, if we look on the screen the PowerPoint, an exemption for Native Hawaiian traditional and customary practitioners that was put into HRS 457J. And it was meant to protect these healers so that they could be recognized by a kupuna council convened by Papa Olalokahi. But there were none that were recognized over those years. And when a lawsuit was filed in February 2024, the court did have a hearing specifically about this, and they found that this current exemption does not effectively protect Native Hawaiian traditional birthing practitioners. So the court did rule to block that law, and Carrie Ann will share on that a little bit more later. So I'm just kind of explaining within this midwifery regulation law, there were exemptions that were in place, and then those exemptions either did not provide the protection that was necessary or expired, even though there was an intent to incorporate all these birth practitioners. I also wanted to talk a little bit back on that other slide about the licensure pathways that were put into HRS 457J. And so if we look at the second bullet point, it says it restricts pathways to obtain midwifery licensure. And it recognizes certified midwives and certified professional midwives, but only if they use the MEEK pathway. So there was an exemption for those who, up until January 1st, 2020, I believe, to use the apprenticeship pathway and the bridge to be able to obtain a license. The current law also allowed for the past 5 years and still does allow midwives from the continent to come here using the apprenticeship pathway and bridge to practice and obtain a license here within our state, but it does not allow local midwives to have the same access to that certain pathway. We do have a letter from the North American Registry of Midwives that they have written specifically for this legislation with concern about HRS 457J and the leaving out of recognized pathways that lead to the same certificate. And this apprenticeship pathway is currently used in 27 states out of the 38 or 39 that currently require licensure to midwifery. So there's a whole bunch of states right now that are using this pathway, and that pathway currently is not allowed for our local midwives. I did want to just make a note that the MEEK pathway, which requires a accredited education, after they are done with their education, they have to take an exam. And upon passing the exam, they receive a certificate. With the apprenticeship pathway, they also have to take the same exam. And if they pass the exam, they get the same certificate. And so NARM did point out their concerns this legislative session that the MEEK accredited pathway is only utilized by less than 50%, less than half for them when they give their certificate for that pathway. So it's not a pathway that's used, in a larger sense. And it would, we'll explain later why it's so important, but this is currently how the current midwifery law that we've had since 2019, what it does and does not allow. So now I'll pass it over to Carrie Ann to explain on the lawsuit.
And I promise that we're not going to give a quiz on all the different acronyms and names and titles because it is a little confusing. Even sometimes I need to pause. Certified midwife, certified professional midwife. Okay, I'm going to talk a little bit about the lawsuit as soon as I can get this. So currently, Native Hawaiian Legal Corporation and the Center for Reproductive Rights, also with private counsel, the ACLU is not involved in the litigation. So I just want to clarify, we have been involved for a number of months in terms of helping to look at other statutory regulations for other states, looking at literature relating to safety efficacy. But really our interest in why we're involved in this issue from a policy perspective is at the heart of this midwifery license is really reproductive autonomy, having choice, the ability to choose whether to get pregnant or not, to have a family or not, to decide who will be there in this most intimate, sacred moment, whether it's your kupuna, whether it's your mother, in-laws, entire family, whether you choose to give birth at home, or at a hospital, but that it is the pregnant person's choice. And we have seen at the federal level literally attacks on reproductive autonomy, bodily autonomy. And we're just very concerned, while that seems so far away from us, we have an opportunity to address some of what I would say are the limitations of our current midwifery law, as well as some of what the court found was unconstitutional. And how do we create remedial legislation to correct this and move forward? Again, protecting reproductive rights. So that's why the ACLU is involved. And when I say ACLU, I mean ACLU Hawaii, also ACLU National. I've been in consultation with them. I have also been in consultation with the attorneys for Center for Reproductive Rights as well as NHLC. So in 2024, after the Attorney General filed their letter, their opinion, this lawsuit was filed. It's referred to as Kaho'o Hanohano versus Hawaii. The attorneys filed a motion, a preliminary injunction, asking the court to have an evidentiary hearing to hear from individuals providing testimony, witnesses. And the assertion or claim from the plaintiffs is that this law in practice was unconstitutional, that it was infringing unreasonably upon their right to Native Hawaiian traditional customary practices. There were other legal arguments raised, but for purposes of this conversation, I'm going to focus on that. The lower court issued its finding and its ruling, and they determined that the current midwifery law in practice is unconstitutional in terms of its effect on Native Hawaiian birthing practices. And so this injunction right now prevents the state from enforcing civil and criminal penalties for individuals who practice, teach, and learn palikeiki, ho'ohonau, and hanau practices, meaning Native Hawaiian healing practices of prenatal, maternal, and child care. So that is currently the law of the land in Hawaii. Now, this was on a preliminary injunction, but the case continues to move forward. The trial is set for next year in 2026. But again, looking at it from a policy perspective, we would love to see legislation that would address and remedy this violation and broaden access so that we can avert the lawsuit, which would help taxpayers who are funding the litigation, right? We're all paying for it, the Attorney General, but also looking at the harm to the community unless we address these issues. And the context for this we need to mention consistently is that there is a maternal desert in Hawaii, meaning that there is a shortage of healthcare providers, particularly in this space, and especially on the neighbor islands. I was born and raised in Maui in the country area. The hospital is very far away, and also in rural communities. So what we want to do is shift gears a little bit here and talk about the proposed legislation, HB 1328. And so the legislative intent is to allow a pregnant person the right to choose where and with whom they give birth. Again, this is fundamental principle to this legislation. It would also expand access to licensure. It would recognize certified midwives. I didn't put it on this slide, but certified midwives essentially have like a graduate level degree. But also through this, what we call certified professional midwife, allow for national certification using this MEEC, this like a college pathway, educational pathway, and the PEP plus bridge, which I in lay terms refer to as apprenticeship pathway, so that we allow for both. And as Kristie pointed out, 27 other states and Washington, D.C. allow for the PEP pathway. And so our proposed measure would also allow that licensed midwives would then be able to practice to the full scope of their certification, education, and training. And that's something we would expect for any type of professional license. If you go to school, go to training for years on end, whether it's a physician, doctor, other carpenters, plumbers, etc., they should be able to practice to the full scope of their certification, education, and training. And so within this legislation, there's also a section that's very clearly labeled exemptions. And I say this and I emphasize it because from an attorney legal perspective, I previously worked as an enforcement attorney with the Hawaii Civil Rights Commission, enforcing our state's non-discrimination laws in both the employment and housing context. And when you have a general rule, it typically applies to all, but there may be sections that we have an exemption, meaning that it does not apply. So in this particular bill, there is an exemption for Native Hawaiian traditional and customary birthing practices, which is in alignment with our Hawaii Constitution. The second exemption that's in the statute is a birth attendant. And this birth attendant language is very similar to the attendant exemption in our current statute before it expired in 2023. And it requires an individual to comply with a number of requirements. There's even a form from the Department of Commerce Consumer Affairs that a birth attendant would need to have it filled out. They need to disclose that they haven't gone through a train, that they're not a licensed midwife. They need to retain that record for a minimum of 10 years. And they also are required to have a transfer plan in place. If there are any complications, that transfer plan is in place. Under this statute that we're proposing, there's also a religious and cultural birthing exemption. And currently, under our nursing statute in Hawaii, there is a religious exemption. Maybe most folks may not know about it, but this is mirroring that language. And you think about it, we have certain rights. We have the right to practice our religious beliefs, our sincerely held religious beliefs. And for a number of people in our community, they have religious, spiritual beliefs relating to birthing practices. Also, we know culturally, we have people in Hawaii from a number of cultures, whether it's Pacific Islanders, there's Native Americans here, Japanese, Filipino. There are some cultural practices that are passed down from families to family, literally over generations. And we'd like to point out that giving birth, I'm a mother myself, in and of itself, is not a medical intervention incident in and of itself. It is not. And these practices have been practiced since time immemorial. And so last, we want to highlight this exemption that we do not criminalize family members who may be present. We will not also criminalize doulas, lactation specialists, other child birth educators, which under our current statute, if they do not obtain a license, they could be criminalized. And I want to add a point about what we mean by criminalization. Criminalization meaning that you could be convicted of a misdemeanor of up to 1 year in our severely overcrowded jails and a substantial fine. And if someone were to be convicted of these charges, that stays on their record essentially forever. And that becomes a barrier to other life opportunities, jobs, housing. You might not even be able to volunteer in your child's classroom if you have a record. And so these are the collateral consequences that we want to remove within our community. And I also want to highlight that we know that there's a definite shortage of healthcare professionals. This is one opportunity for individuals in our community who want to obtain either the certified midwife certification if they go away, or the MEEK. But for those who want to train here in Hawaii under preceptors, supervisors, that they have the opportunity to do so, to take that exam from North American Registry of Midwives, NARM, and if they pass it, to serve our community, especially in the communities that are the most under-resourced and absolutely need more health providers. This is in bold yellow, because there are a number of bills, literally 3,000 bills each legislative session. So this is the bill that we are collectively supporting, meaning Hawaii Health Birth Collective, ACLU of Hawaii, now Office of Hawaiian Affairs, the Board of Trustees unanimously passed support for this. Maui County, Hawaii County, Kauai County. There's literally a list of organizations, a number of Native Hawaiian organizations and other community organizations that have added their name in support. And the committees that this bill is assigned to, there's some acronyms here. HLT is for Health /CPC, Consumer Protection. And after it moves through that joint committee, it will then be referred to Finance. And of note, you can see that there are multiple introducers of this bill. Representative Ellie Cochran from Lahaina, Maui, and she speaks to the personal stories of the importance of so many traditional midwives and birth workers in Lahaina after the fires and what they still continue to provide for the community. You see by the names here listed that this bill is supported by both Republicans and Democrats. It is a bipartisan issue, and we hope that the Chamber of Sustainable Commerce will continue to support this measure as well as individuals here. And with that, I'm going to turn it over to Laulani to share historical context about the current law and what we look to see for the future. Laulani?
Aloha, everyone. I'm Laulani. I'm Laulani Teale. And let's see. I'd like to share a little bit, just a really brief background. I know that many of you have some familiarity, but I just always want to start out with the concept that in Hawaii, for us as Hanau practitioners, it's really important to understand some very important things. First of all, Hanau is our oldest practice. So it goes back all the way to the very, very, very beginning of our genealogy when the great pole, the great night, gives birth to the light. Yeah. And then from there, it's one birth after another, all the way through the coral polyp and the tube worm, all the way through the time when Papa Hanau Moku serves as a midwife to her daughter Ho'ohoku Kalani, who gives birth to first the kalo as a stillborn, and then to Haloa, whose name is Haloa, and is planted in the earth and comes up as the kalo, and then to Haloa, the first human being, who is therefore the younger sibling of the kalo, and thereby is created the relationship of health between humans, Aina, and me'ai, and all of those things that keep us healthy, that bring ola, that bring life to us. So this is a very, very important relationship, and that goes down through genealogy from one tutu to the next, through all of our great, 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 great grandparents, all the way to our grandparents, and then to us. Of course, the last few generations in the story of Hanau have been a little rocky, right? They've been a little adventurous. So it's important to look at that picture in terms of understanding where we are today with the legislature. So if we look at 1890, that was the year that the first babies were born in a hospital in Hawaii at Kapiolani Hospital. 6 babies were born in 1890. And so if you can think for the rest of the population, all the rest of those babies were born somewhere that wasn't the hospital, right? So, and then generations after that, those Hanau traditions that again have been passed all that way from the great po to the future, those continue on. So, of course, when those babies who were born in Kapiolani Hospital were not even 3 years old, the world changed in Hawaii because Iolani Palace was invaded, and that became a time of great repression for Hawaiian culture. Yeah, on many levels. So there was a lot of deliberate displacement, right? Displacement of our language, displacement of our traditions, and in particular, our healing traditions were displaced. So the kahuna were deliberately and very severely repressed at that time. And one of the main tools that was actually used to repress them, I mean, on one hand, And this is something that you see in colonialism worldwide in indigenous stories. On one hand, you see this really very severe jailing, sometimes killing of spiritual and healing practitioners, and just real dissing, really bad dissing, and like a whole medical establishment coming after them and putting them down, and talking about them like they're dirty and unknowledgeable and dangerous and all of the things, right, that we're still being called today, quite honestly. And on the other hand, you see this idea that, oh no, we're supporting you. So the way that support looked was licensure. So the licensure came in the form of a written test for kahuna la'au lapa'au, right? That they were made to take, no, absolutely. They were made to take a written test that, I'm so sorry, that had, for example, the names of all the herbs that they would use. Now, if you know much about la'au lapa'au, you know that the idea of putting these herbs, these sacred practices into written form is already like very culturally inappropriate, right? But on top of that, they had the names of the herbs in Latin. Okay, yes, Latin, right, for these kahuna la'au lapa'au at a time when we were still coming out of Hawaiian language being the primary language. So at that same time, you had midwifery license started. And I want to emphasize that in the entire time, from the time that midwifery licensure began in the early 20th century, and then it ended. Why did it end? It ended because licensure became so restrictive that no one could comply with the terms anymore, and it stopped. So that's a very strong lesson because that's happening again. So it became less about facilitating those who had the knowledge of that clinical licensure, right? And more about restricting that practice because they actually did not want it to exist. And that clinical licensure, it should be emphasized, was not Kanaka. So from that time of the early 20th century till now, not one Kanaka Maoli has ever been licensed as a midwife. Now, there are many who are on the path, and they're awesome sisters. I totally support them. And they've tried their best, and they still have not achieved licensure. And there's a reason for that. And that reason is called meek schooling, which is simply not realistic in Hawaii for parents who, and it's usually young parents who take the path of learning hanau practices in whatever form, clinical, traditional, whatever they may be, as I did. And learning that when you have small babies and children to take care of, right? So it's not the easiest time to be doing a schooling that is located elsewhere. Even if you're doing a lot of that online, it still kind of doesn't work. It has not worked yet, even for those who've tried very hard. Okay, so I think it's important to have that context so that we can now see the situation in which we are in the present day. And the situation in which we are in is that we have all of these wonderful forms of midwives. We have clinical practices such as the CMs, the CNMs. We have who are nurses. We have the CPMs who come in both the meek schooled clinical style and the apprenticeship style. And then we have all of the many kinds of traditional practitioners. That includes religious practitioners. It includes it includes grandparents and, a lot of times kane in Hawaiian culture who are, who become experts in hanau because they're able to take orders from the person doing the hanau. And that's a very important thing to understand about hanau practice, is that in our view, right, in our culture, the person doing the hanau is the person giving birth. It is not the midwife. It is not the attendant of any kind. It is the person who gives birth. And that is extremely important to remember. I'll just say real quick, I don't want to be too long, but I'll say that in my own experience, I began this journey 31 years ago when I was pregnant, 32 years ago now. When I was pregnant with my first child, I was born in Kapi'olani Hospital, just like those babies that I mentioned earlier in 1890. And it was a struggle. And, my mom tells me the horror stories in those days, how she was chain smoking during labor with me while they did all the shaving and the this and the that. And oh my gosh, it was crazy, but we're an evolving people, right? We're all evolving. And anyway, so I came from that understanding, and and she was born at Kahuku Hospital with a whole nother story. But her mother, my grandmother, who I was blessed to speak to a lot about this, was born in Kahana Valley, at the place where my great uncle Nana's lo'i still is, up in the back in Kahana Valley. And that is where my great grandmother gave birth to her. And I have the stories about how that happened and the stories after that and all of these things, and just a lot of stories, right? So when I set out to become a hanau practitioner, a young mother, I didn't know any midwives, but I knew that this is what I wanted to do. And fortunately, I was able to meet a wonderful haole American midwife who, not only helped me to give birth under extremely adverse conditions, which are a whole different story, but also began teaching me, and also introduced me to others that I then learned from, as I also learned from other kupuna at the same time. So, I was able to absorb from many, many sources and basically be able to carry on these traditions and learn a lot about the many practices in our community at the same time. And then these practices became legal. So we saw a hanau renaissance from 1998 to 2019. And during that time, we had many young practitioners who came up and became midwives and became all kinds of traditional practitioners, some clinical practitioners, and basically lifted this practice of hanau back into practice and integrated with all of these other wonderful traditional and clinical practitioners who exist in our community. And through learning from each other and supporting each other, we've created this beautiful network. And that is where our legislation is, that we've spoken, I believe, with just about every type of midwife. And this legislation is designed to support the traditional practices first, because if you throw those under the bus, that is something that is not okay and is not going to result in pono. But the traditional practices are protected. And then upon that, we have all of the clinical practices protected to the greatest degree possible. And having worked in the relief hubs in Lahaina for quite some time with the midwives, the traditional midwives who serve there, even though we're all illegal, right? We, sometimes you just got to do what you got to do, right? And So having done that, having been through this experience, I really got to see how the communities desperately need care. They need us. They need all of us. All of us. And they need us not to be fighting. They need us to no longer be throwing each other under the bus. They need us to no longer be existing at the expense of one another, but to all come together to create something that actually works. And that is what 1328, HB 1328, honestly, after so much work was put into it, I believe that it is something that lifts up the practice, all the practices together, so that we can all join in and address this very, very serious maternal health crisis. I'm almost done, but I'll just say that Kanaka Maoli, Native Hawaiians, have the highest maternal death rates in not only Hawaii, but in the United States. Native Hawaiians and Pacific Islanders have the highest recorded death rates, higher than Black people, higher than Native Americans. And those are very severe rates themselves. And the reason for that is the loss of ea, loss of self-determination. So anything that impacts that ea, and my mentor, Dr. Richard Kekuni Blaisdell, was an expert in that, in how ea, self-determination, the life breath of sovereignty, is really the key to our health. And if we can restore that, if we can all help to restore that, and all help to restore that in each other, no matter who we are, we will flourish. And we will flourish in a way that keeps the original culture, the original patterns, the original wisdom intact and not lost, not exterminated, not displaced, but really flourishing in support with all of the mutual practices that can exist together to serve our community and turn the situation around to one that is really, truly ola, health, wellness, and life. Mahalo.
Mahalo, Laulani. And so we just want to thank all of you. And we also want to open up, though, if there are questions from community members, we have here our contact information. And for those of you, feel free to open up with questions now, or if you want to reach out to us later, we are providing our contact information. But as Tanya pointed out, we learn from one another. So sometimes if you have a question, someone else may also have.
Aloha, everyone. I did have a comment regarding exemption. We recently had a wonderful gathering on Maui with a lot of a real variety of midwives. And one of the traditional midwives said, when we were discussing the exemption, and so I think this is a real important question. She expressed that she thought that filling out the form, having to fill out a form, was unconstitutional. So even though in this bill that we have, that we're so positive about, that has a lot of good things in it, and we talk about the exemption and this form that's filled out and kept for 10 years, it sounds to me that the traditional practitioners might not be in agreement about having to fill this form out. And so I guess I'd like to start with Kristie, if she can respond regarding that, and then maybe hear from the other two. Thank you.
Sure. Was this in regards to HB 1328?
Yes.
Okay, so in HB 1328, we have, like Carrie had mentioned in the slide, different exemptions. So we did not want the cultural or religious practitioner to have to be required to fill out any form. So they have a full exemption, which actually is, copied or taken from our own Hawaii nursing law, which provides a full religious
Yes.
exemption with no disclosure forms required. And so with HB 1328, we do have traditional birth attendants who are required to fill out the form, and many do feel okay with that, but we do make sure we have a place, different exemptions. So our Native Hawaiian healers specifically have their own exemption because they are completely protected under the Constitution. And so we just wanted that statutory protection to be very clear for that group. And then we have another exemption for cultural and religious practitioners of other cultures and religions, who also the nursing law it's copied from the nursing law. So hopefully that, I think, Laulani, if you have anything to say on that, but that allows them to have that place, so they're not forced against their own, guidance and convictions to have to follow a form from the DCCA.
Yeah, and that is so important, because that is one of the things that we are taught, like in my La'au Lapa'au training and some of my other really sacred trainings, we're taught never to sign any forms as part of our work, right? As far as our healing work is really sacred, and we can't do it. So anything that would require us to do it is not going to do that. Also, we can't, in regard to the other bill, we can't say that we're not a midwife if in fact somebody gave us that title, because the title is actually given within the community in our tradition. So that's another consideration. But as far as the one in 1328, the only people who are required to fill out that are the traditional birth attendants. So they're not cultural or religious practitioners per se, but they are traditional practitioners, if that makes sense. So, but they're not Hawaiian traditional practitioners, because Hawaiian traditional practitioners are exempt under the constitutional exemption. So, yeah, they are, they're like somebody who is, for example, kind of a lay midwife in the old school grandma kind of term, but who sees people in the community may want to do that exemption, because it fits them. They're not necessarily identifying as cultural or religious, but they are, they do need to be covered.
I'm sorry, I didn't get your name, the woman who just asked the last question.
That's Annette.
Annette. Okay.
Annette Minot. I'm the president of the ACM affiliate here in Hawaii.
Okay, nice to meet you, Annette. Thank you for asking that question. So hopefully we clarified, and I just want to add, just for interests of the PowerPoint, there's even another exemption that's clear. For example, if someone were rendering aid, if there's an emergency and somebody's there that, that they're not practicing in illegal midwifery. So, but these are the ones we wanted to highlight, and hopefully that clarifies the confusion. But for the traditional birth attendant, there is a form, but the other exemptions we mentioned here, Native Hawaiian traditional birth practitioner, religious and cultural, there are additional requirements.
Thank you.
Thank you so much for asking that question. Other questions from community members or even concerns?
I have a quick question, Carrie Ann. So I just can see that it's been referred to the, like you said, the Health Consumer Protections Joint Committee. Do you have a date where that might be happening, or we don't know yet? We're still in
good
holding
question.
pattern?
Good question. Well, it was interesting. Originally, the bill was assigned to different committees, usually not subject matter, but as of last week, Friday, it was reassigned to Health and CPC and CommaFin because it's considered two separate hearings. We're looking at needing a hearing by the middle of next week. And so there are a number of us who have reached out to lawmakers, for the chair committee for health is Representative Takayama, and for CPC Consumer Protection, it is Representative Matayoshi. And so if any of you, or as an organization, you're inclined, we'd love the additional support if you'd like to contact them and just encourage them to schedule a hearing so that the community has an opportunity to testify and really to highlight how this bill is meant to expand midwifery care and maternal health care in Hawaii.
I see Dave Mullinex has a question, or his hand is raised as well. Dave?
Yeah, hi. My great grandmother was midwife, and she was a traditional indigenous midwife. She gave birth to, or helped give birth to, all her daughters and granddaughters, even great granddaughters. So I'm very supportive of this. So what's the, do we have any sense, because there's been so much pushback from the legislature and so much resistance to this. So do we have any kind of a feeling that it's looking better, or, I mean, what's the feel do you have for this now? This is really great what you've done. And I was wondering, are you getting any good support from anybody, from any of the legislators who are working, like Peruso or Bellotti or Amato, any of them have any, encouragement?
Yes, I think so. The legislative process is inherently political. There are a few other midwifery bills. And so I think part of it is continuing to educate the community. We are putting together a chart that will be a side-by-side of the current midwifery statute versus what we're proposing. There are a few others, but we're really going to compare it to really narrowing it down to 2 bills. And I think that most community members will reach the same conclusion as us, is that this bill that we are supporting is the most expansive in terms of midwifery licensure and care, job opportunities, workforce, and ensuring that people are not criminalized for practices since time immemorial. And Laulani mentioned this, the importance of integration. When you look at other countries as well as other states that have better maternal health care outcomes, one of the common theme, and even through the literature, especially internationally, is the number of midwives in communities. So to the extent that we can have more midwives in our communities, on the different islands, in rural areas, even in the city for that matter, and that we work towards an integrated system. Laulani has reported, and others have reported in some of the data, that since this law has been in place, and there is this word out, right, that this bill, if you don't have a license, that you're subject to criminalization, there have been a number of traditional, midwives and birth workers who have been fearful of being criminalized. And so they've stopped practicing. And what does that mean when we have a maternity desert? The other example of that is we've also heard statistically that there's been an uptick in the number of pregnant people giving birth, unattended births. And that's clearly a higher risk than having a number of people of care, traditional midwives, birth workers with them. And I want to share this one story because I think it really illustrates that there are threats even to our own reproductive rights here in Hawaii. So I mentioned to you that I'm from a very rural area. I was born and raised in Maui. I'm currently in the city, but my niece gave birth last year for the first time. And when she went to the federally qualified healthcare clinic on Maui, they confirmed that she was pregnant, and they gave her a form, and they essentially gave her the option of, if she wanted to continue to have care from this health clinic, she needed to sign the form and essentially say that she would not have a home birth and seek other providers. And my niece, this is her first time, baby, young. She was really scared, but it also shook her that she was being forced to make a choice that if she were to decide to have a home birth or seek outside care, that she would lose the possibility. And so she signed the form. And it just saddens me that my niece has less rights than I did giving birth 13 years ago. And that my mother had even years before that, and her mother, because there were options back home. Some people, gave birth at the hospital. There were people in our community where we grew up who were known as traditional midwives who came to people's home. And why are we criminalizing choice? It is about reproductive justice and preserving these practices. So thank
you all for your efforts. This is really wonderful.
Can I just say something about that form that the Maui uh,
Sure.
federally qualified community health center had her farm. I was outraged by that, as it was unbelievable. I have worked here on the Big Island for a federally qualified health center, and I was shocked to hear that. And I since explored that, and they have rescinded that. So that's no longer on the table. But it was shocking that they even thought to do that. And there are a number, so you hear of these stories of different health centers, different clinics, where the physicians, if the woman has seen a midwife or home birth provider at all, if it's anywhere on her chart or mentioned, they'll say, we won't care for you anymore. So, but it's still out there. And it's really shocking. You're absolutely right about
Yes.
that.
And I did hear on Maui that federally qualified clinic has since rescinded their policy
Yes.
positive.
Yes.
But I know that within the time frame that I heard that they changed the policy, my niece was never notified of that.
Yeah, I'm sure
And
she
so,
was.
it's like that time passed and that she can never get that opportunity back. And so I just think, I think it illustrates that there is still this stigma that some people have. And we just want to ensure that we collectively protect these reproductive rights and choices within our communities and allow people to make decisions for themselves. And I'll just add that this is another story, but I won't name names. There are several lawmakers, but there was a male lawmaker when I was discussing midwifery last year in licensure, and he was very passionate about his position. And he says, well, I absolutely believe that sometimes we as lawmakers, we have to pass laws to protect people from themselves. And of course, this is in the context we're talking about pregnant people having choices. And so we still have a lot of work and education to do to ensure that we carry on the legacy of other people who have fought for us to have these rights.
Very good.
Absolutely.
Well, here we are.
Carrie Ann, there's a question in the chat on how does this affect HB 434, which has been recently deferred. I think last week it was deferred. And let's see, I just looked that up. So that committee was also health. And
that's the doulas bill?
Yes, that's the doulas bill.
Yeah, so I wasn't as closely involved with it. I did read it some time ago, but I know that probably Laulani or Kristie may have a little more information. I heard it was deferred, meaning it was killed for this session.
Okay.
Yeah, so this bill or this issue is especially powerful because the licensure law will end if nothing is passed. So there is a sunset date, like we mentioned. I think it's June 30th, 2025. So there's a lot more hanging on to the midwifery issue right now than the doula issue, which got deferred. I heard there was requests for sunrise auditor reports to be done, prove that it's harmful, all sorts of other little things. It's like the beginning, the conception. Right now we're at the birth. And, by the end of this session, something will, if nothing is birthed, right, the whole licensure program will end. So it's really important that this bill, which is, so expansive and comprehensive and respectful and clear, and it allows our poor midwives. I mean, for the past 5 years, some have had absolutely no access to the amazing training and education that their credential should have given them, but the law didn't. And so this bill clearly does that. It was worked on by national organizations that helped craft the language in this bill to make sure our clinical midwives are able to provide care in the community that is at the level of what they've been trained in, but also for the benefit of the consumer to be able to now have equal access to this type of care. And that's exactly what HB 1328 does. So thank you. Thank you for that question. And we will continue to follow. I would say next year is important to follow the doula issue again.
So, Carrie Ann, can you just repeat one more time the call to action that we have, which is to ensure that we get a hearing?
Yes. So the call to action is to call Representative Takayama, Greg Takayama, and Representative Scott Matayoshi, they are the chairs of Health and Consumer Protection, asking them to schedule a hearing on HB 1328. And once it is scheduled for hearing, we'll try to, through our different social media, email channels, word of mouth, Coconuts Wireless, if you can really rally other people and support. If you have the opportunity to testify in person, I would encourage you to do so, but I know that that is not always possible. So you have an opportunity to testify virtually no matter where you are in the world. And if you can't for that reason too, but you would still like to, raise your voice, you can submit written testimony and that will be a part of the record. And I think really highlighting, even if you don't have time to read the entire bill, it's about 50 pages, what resonates with you? Why do you support this? And really framing what we want. Where do we want to go to build this licensure system, not only for ourselves now, but really we're looking to build this for future generations.
Can I just remind everyone too that if people call to request this hearing, it should be very, very respectful. I can't emphasize enough that the last few years have been really traumatic for all of us, including the legislature. And so I think that there is some trauma left there. And we want to ensure that in order to make a safe U-turn, everyone has to feel safe. And so it's really, really important that we turn our passion into, a lot of aloha and to speak with a lot of respect and aloha. And also, it's not the time to bring up any other bills because people may have different positions on that. So to really focus just on 1328 and to give it that fair hearing so that they can hear from the community.
Great advice. Thank you, Laulani.
Does anyone else have any other questions? Wow, I just want to say thank you to all three of you guys. All three of you women are just extraordinary. I'm so excited to meet you, Carrie Ann, as well now. So you guys, you have all of their contact information. Maybe you could put that slide back up that has your contact information so everyone can see that. Because I just wanted to reiterate, this isn't just a maternal rights and human rights issue. The reason that the Chamber of Sustainable Commerce is involved is because this is about expanding the economy and allowing people to practice a profession that's been around since the beginning of humanity. So it's kind of crazy that we have to, we're going backwards somehow, but let's hope that we can, get this on the agenda this week and we can move forward. So thank you guys for all of your efforts. I think we're all just saying thank you.
Mahalo.
Mahalo, everyone.
Thank you so much. And if I could just maybe make a shameless one last plug is that, as the bill moves throughout the legislative session, that is, our hope, and we will continue to advocate for that. Maybe there might be an opportunity later in the session, perhaps to maybe do a follow-up, like a webinar or talk story with folks just to see where we're at, because I think this is about empowering our community and voicing the type of healthcare access to midwifery that we all deserve and need, again, for ourselves and for future generations.
Is there a crossover bill for the Senate for this bill yet or no?
So that's where it gets a little tricky. There was another bill in the Senate that was introduced by Senator Carol Fukunaga. It was somewhat of an earlier version, an older version draft bill, but when it was sent to the drafting agency, and I know that they're really inundated and flooded, but a number of key provisions were missing, and even the pages don't match up. So the ideal would have been to have a companion bill, but that other bill does exist, but it's missing some very significant language. So we're focusing on the House right now, although there is a Senate bill. I can't tell you what that number. Yeah.
And while she's doing that, I just want to send a shout out to the awesome people who are on this call. There are so many. I'm just looking at the list, and there are so many people who have been so deeply involved in so much of this work for so long. And just if we look at the collective birth knowledge of the people on this call right now. It's in all the different ways. It's just mind-blowing. So I just want to really, really mahalo and acknowledge everybody who's on here. I can't even start naming names, but
and we are recording, so I will send the link out to everyone. You'll all be on a BCC, and you can share it with your networks. It's going to be on the Chamber of Sustainable Commerce YouTube site, so, and accessible through our website as well. So share it and let everyone get up to speed on this so we can get as many people to make our calls this week. And then hopefully we will have the opportunity to have a follow-up.
Thank you so much. And for more information, you can follow Hawaii Homebirth Collective on Instagram to learn more about the legislative session. Thank you, Tanya. Thank you, everyone, for coming. And if you have questions, just let us know.
Mahalo.
Thank you, everyone. Aloha.
Aloha.
Take care. Aloha.